Hey, I'm finally back, and today I'm going to talk about something pretty far out of my wheelhouse. Again, just as always, this channel is based on my own experience as a patient, and in this case, as a family member of a patient. I just wanted to tell the story of my mom's decline into metastatic breast cancer that happened over the last couple of months. We thought that she had COVID for sure. And her first bout with COVID was really hard. It was last spring, and she had a lot of really strange symptoms, and she struggled a lot with sleep and anxiety during that time. She had a really long recovery, and we thought maybe she was having some of the same kind of symptoms again. She wouldn't go into the hospital. She did do a doctor's visit with her nurse practitioner online after Christmas, finally. And I was sick with COVID after Christmas, so I didn't see her for a couple weeks. And when I saw her again, she was way worse, really fatigued and sleeping a lot. My sister and I convinced her to go in and get checked out, and she got a chest x-ray. She was coughing at that point and also kind of gasping between words. She said that she had full ability to take a deep breath, but she just couldn't talk very well without gasping for breath. And so we were really confused about that symptom and wasn't sure, maybe she had pneumonia. But it turned out that she had a 5 centimeter mass in her lung, which is presumed to have been metastatic breast cancer. My mom didn't want any further testing or scans or treatment. Her number one option was to get a CT scan to see where the mass was and whether it was possible to biopsy. And if she had been younger, she was 90, but if she had been younger, then I think the doctors would have really pushed her to do that, even though she had a lot of claustrophobia. She was very, very firm about being unwilling to do any of the kind of investigation or treatment. And we were still talking about treatment, trying to get her to just take a little bit of an AI, letrozole or anastrozole, or exemestane, the 3 types of AIs, aromatase inhibitors, that can shrink a tumor when you have metastatic breast cancer. She declined that option after talking about it many times, and we put her in hospice just a couple of weeks ago. And she only lasted in hospice for a few days. So I've had the very rapid experience of giving care to someone now who has experienced the other end of the spectrum from me, having had a very rapidly progressing metastatic breast cancer occurrence in the lung. I was with my mom for the last 2 weeks of her life almost constantly, and my family was in a lot of turmoil. My mom was not so much. She has been telling us for the last year that she was really done and had written the last chapter of her story and was ready to go. And I was listening to her to some degree, but, of course, there's a lot of denial in that. But I'm grateful that she was that honest with us about how she felt about her life ending, and that was definitely a gift to be able to have a little warning. I just really had no idea how quickly it would take her. And from her perspective, it was a blessing. I think she didn't have much pain at all. She only had 1 night of extreme stress and anxiety. And even that was, probably could have been prevented if she had been taking her meds a little bit better. But overall, she had very low amount of anxiety and pain, and she really just struggled that last night. Just want to share some of the highlights and the lessons learned. If this is of interest, I can talk a little more about it in the future, but I wanted to be sure and talk about it right away while I still have the really important things in mind, and also because it'd be really easy to skate over it and then not come back to it, and I think it's a really important story to tell. I learned a lot about hospice. I work as a nutritionist in kind of a skilled nursing facility, residential retirement home setting, and so I work with hospice providers all the time, but I don't really get to know them, and I don't interact with them a whole lot. So this was very new for me to participate in hospice as a caregiver. And my one regret with hospice is that we didn't enlist them sooner. My mom was very firm, and her oncologist, who has been my oncologist in the past and probably will be in the future again, was really great about affirming my mom's freedom to choose to do no further investigation or treatment, and affirming that that's a legitimate decision. And I think that it's really hard to find someone that can do that well, and this oncologist was amazing at it. And she really encouraged us to look into hospice. And the hospice providers that we went with, they responded right away. There was no delay. There was no waiting, thankfully, because we wouldn't have made it onto hospice if there had been a waiting list. I just want to say how amazing hospice nurses are. This is maybe where I'll get a little choked up. My first couple of hospice nurses that trained me to administer meds were like angels to me. They were so beautiful and firm and assertive in all the right ways. They were master educators. I needed a lot of education. I didn't appreciate morphine. I was afraid of it, as were my siblings and the rest of my family. I think we all imagine morphine as being administered on really high doses for pain. My mom wasn't in pain. She was just having a little bit of respiratory distress. So she needed very micro doses. And I think, all of us imagine what happens to people who are in pain taking high doses of morphine. They're knocked out and they're not able to interact. And me and my siblings were all, I think, pretty afraid of that and overreacting to the morphine for that reason. But the nurses were really clear and really direct with me especially, and I wish they had been able to be more direct with others. But they got me to a point where I was able to really embrace that as a treatment for my mom's comfort. And I was able to administer it with confidence, and I felt really good about it. And I realized after a while that my mom was fully cognizant. She was not knocked out by it. She was able to communicate with me anytime she had a need, even when I was giving her a little bit higher dose every hour. At the end, it was a higher dose, a full milligram, which is not that high, but it felt high to me. It was a full syringe, and it was an oral liquid administration because that's just, I guess, what you do on hospice. It's easier to administer that way, and it takes effect right away in the mouth. So anyway, it took me a lot of education and confidence building to be able to be comfortable with that drug. And but the nurses got me there, and they did it quickly and with a lot of support and firmness, and that's what I needed. So I'm a huge fan of hospice. I happen to have a friend who's a hospice social worker, and I called her a lot when I was struggling, and then I also called the nurses on many occasions for my hospice team, my mom's hospice team. Another thing that I want to say that maybe is unexpected, certainly unexpected from my perspective, if I look back maybe a year ago, I was not comfortable with the use of cannabinoids. And in the last year, because of my mom's COVID struggles and her struggles going to sleep, I became more comfortable with cannabinoids for myself and for my family for the first time. And I got really educated really quickly on that back in spring of last year when my mom was having multiple nights where she couldn't sleep in a row. And I was scared for her life at that point. She was always a very strong person physically and always in good health, but the COVID was a big exception to that. It was a really scary time. And her neighbor in her apartment community, her retirement complex, offered her a gummy one night because she was desperate, and I was pretty nervous about Mom taking it, but it really helped her. And so I started to do research, and I called a doctor who is a specialist in geriatric use of cannabinoids, and actually got a consult with him last spring. And Mom has been taking cannabinoids every night since then until she died for sleep, and she really clinged to that prescription. And it was a great combination of CBD and a little bit of THC, and it worked really well. I went right back to that doctor when Mom was diagnosed with metastatic breast cancer, and he prescribed a similar daytime dose, just mostly CBD with a little THC, to help with her respiratory distress. And I believe that that gave us a couple extra weeks with Mom, that was able to hold off the morphine in a way that made life really comfortable for her when she was just having a minor amount of respiratory distress. And we didn't have her x-rayed or anything, so I don't know for sure, but I was under the impression after the first couple of weeks on cannabinoids that she probably had her lung collapse, and so she had a real sudden need for morphine right after we got her enrolled in hospice, and that's when we switched her on to morphine, and she needed quite a bit of morphine, and then her respiratory distress really increased exponentially every day for about 3 days, and that's when she died. We only know that she had metastatic breast cancer because of tumor markers, and this is another lesson learned. My mom was diagnosed with early breast cancer, stage 2, slow growing, back 3 years ago, the same year that I was diagnosed with early breast cancer. And she had a lumpectomy, and she didn't have any imaging at all other than mammogram. She had a biopsy and a quick lumpectomy, and then annual mammograms since then. I don't know if she actually had metastatic breast cancer back then because they didn't do all of the things that you would do to find out. They didn't do a PET scan, certainly. They didn't even do an MRI. And I don't know if they even took tumor markers back then, and I'm not able to find out now because her record is closed. So I'm not sure that she didn't have metastatic breast cancer back then. It's possible that she did. But certainly she could have been given the blood test for tumor markers over the last couple of years, and she would have found out a lot sooner. Now, it turns out that it's okay. My mom really wanted to die this year, and I'm at peace with her making that decision and really happy that it went so quickly for her sake. But if it was me and I was 70 or 80 and not 90, I would have wanted to have tumor markers run and know that I had metastatic breast cancer a lot sooner than she did. And so a big lesson for me is I'm always going to demand to have either tumor marker blood tests or an annual MRI and maybe ultrasounds, or PET scans. I mean, if it comes available and it's affordable at some point and my insurance covers it, I would take a PET scan annually. So I've learned that surveillance is even more important than what I thought it was, and I was already on this bandwagon to begin with. It's just shocking to me that she could have a 5-centimeter mass in her lung and nobody would know it until she was less than a month away from death. My mom was pretty strong. Her CBC was really strong. Her liver was really strong. Like, all of her blood tests came back great right after she was diagnosed. So there's no reason, other than this tumor, that she would have died so quickly. And we could have known about the tumor way earlier. I'm not complaining. I'm not going to make an issue of it with the hospital or the system. But from my perspective, for my future health, I am really learning a lot from it. We actually were still trying to talk her into taking an AI just less than a week before she died. And if she had, she would not have benefited from it. She would have gotten all of the side effects, none of the benefit, because AIs take a number of weeks to start working. So it's a blessing that she didn't end up taking the AI. It's interesting to me. I think once you start dying, if you're 90, your organs are old. They're going to shut down a little bit more quickly, I think, than a young body would. I've only been able to find the story of one other woman who had metastatic breast cancer to the lungs and didn't take treatment for it. And that woman was 40 years old, and she lasted 6 months. So her body lasted a lot longer than a 90-year-old body. And I think that's where it makes a big difference, is when you start to break down, your organs start to break down. Mom, her body just failed really, really quickly. And that was a blessing, I think. But for myself, looking forward, I want to know way, way sooner than my mom found out. She started feeling really tired in early December, And then my whole family got COVID and we weren't able to be around her and force her to go into the hospital. And then there was an ice storm in January, and again, there was some delay in getting to her. And so it all worked together for an okay outcome. I think it was the outcome that she wanted most. So again, it's hard to complain, but again, I can learn from the experience and really want to learn from it. It's made me a lot closer to that oncologist that we met with just twice for my mom. I feel really bonded to her through this experience, and I think I'm going to go back and make her my main oncologist because of that. So I'm grateful to her. I'm going to be writing cards gushing about how wonderful the nurses were in the hospice program, mentioning 2 of them by name and hopefully getting a hold of 2 of them to thank them. And I'm just so grateful for Dr. Kogan. Dr. Kogan is the one that prescribed the cannabinoids and really helped me through that process, both last spring and this last month, caring for Mom, and just gave me so much confidence that I was doing the best possible thing for her and her comfort. And I highly recommend Dr. Kogan if you're dealing with cancer-related pain or sleeplessness, or just, getting ready to go on hospice and not wanting to go on morphine quite as soon. All the icky kind of side effects of morphine are another thing that I was dreading, like the constipation and the itchy skin. Mom didn't have to go through that at all, but if you are looking at a longer trajectory on hospice, I highly recommend doing the cannabinoids for the first half of your hospice comfort treatment and then moving into morphine for the second half. And I think Dr. Kogan probably would be willing to work with folks around that. I met with him online. He's on the East Coast. He's the head of the School for Integrative Medicine at George Washington University. So you can find him there if you're interested. But he specializes in geriatric care. So I'm not sure that he would see folks under the age of 40 or 50 necessarily. I'm not sure about that. But he also has a book that he's written that I will link below in the show notes if you're interested. But I just wanted to express my gratitude. I want to talk just at the very end of this video a little bit about what it was like to be with someone who was dying, because that was the question that I most wanted answered, and I couldn't really find it. I looked up a lot of hospice resources. There's Hospice Nurse Julie here on YouTube, who's great, and she does a lot of really frank conversations about what end of life is like. So that was my best resource that I could find. But for me and my mom at age 90, again, a very quick decline, I learned about how peaceful death is, that it's not as scary as I imagined. And I haven't been with someone dying for more than a few minutes in my life. So this was very different. I was with her for days. And it was really just one night that her body started to really shut down. Probably more like 24 hours. Her muscles stopped holding her up at about 24 hours before she died. And feel free to, of course, tune out if this is too triggering for you. But I think it might be useful if you're looking for this kind of information. It was interesting because my mom, having a tumor in the lung, couldn't breathe at different times. And so her main crisis was, I can't breathe. And so she could always breathe better when I sat her up. And there was a beautiful hospital bed that hospice brought in for her. And that would get her elevated, almost all the way up. Definitely more than a 45-degree angle, but she sometimes just had to sit up completely upright. And so that was a lot of work for me because her body was not light. Her muscles were completely shut down, and I needed to balance her and keep her up. And so what I ended up doing was sitting behind her and holding her from behind like an armchair would. And that gave her relief, and that seemed to really work well. But yeah, moving her around was really difficult in the last 24 hours. And I noticed in the last just 8 or 10 hours, she was really clingy with me. She didn't want me to leave the room. She always had her eyes closed, but somehow she knew that I was leaving the room. And in my mind, she was still going to be around for another week or so. And so I was not at all aware that this was my last few hours with her. But she would call me back into the room, and she'd ask me to just sit with her or lay down next to her. And I would lay down next to her, and I read a poem once, or I hummed or sang to her a little bit and just talked to her. Sometimes she would smile, and I would ask her what she was smiling about. And she asked for what she needed. In the very end, her breathing got more labored, and I had to administer more meds, not just the morphine, but another med whose name I can't remember. And that was hard for me, just to see her kind of a little bit more knocked out. And the nurse came at that point and really helped me to situate her in a really comfortable way. She noticed her body language and what she seemed to be more comfortable with, and helped her get into that position to sleep. And at the end, she was just sleeping, and she was due for another dose of medication. I gave her the dose of medication while she was sleeping. Her breathing was a little more labored, and so that kind of confirmed that she needed it. And then just like 15 or 20 minutes later, I happened to be sitting next to her, and she stopped breathing. And I was really shocked, because I thought, again, at least another day or two. The nurse thought she could last another day or two. So I was not expecting that to be her last breath. But I was there, and I was playing her favorite song, coincidentally. My brother was out of town, and the hardest thing for me at that moment was knowing that my brother wouldn't be back in town in time to say goodbye. That was really worrying for me. But being with her while she was breathing her last breaths, and after she breathed her last breaths, was not a fearful time. It wasn't a stressful time. It took me about a half hour to even feel very emotional about it, except when I called my siblings to tell them. It was just really, really peaceful. And as a result, I now have an experience that makes me less fearful about getting cancer again. I think leading up to this experience, I was very fearful about getting a recurrence. I mean, I think about it constantly, and I think about surveillance constantly as a result. And after this experience, I feel that I am so much less fearful. So much so that I almost would recommend that if you do have fear around death and recurrence, it might be a good practice to become a hospice volunteer and just witness death a little bit and get comfortable around it and see that it is not as scary or as worthy of all of our fear as we the amount of fear that we give it. That's a huge lesson that I'm coming away with. And that's the reason I wanted to talk a little bit about this kind of last few hours experience. I took a lot of photographs of my mom, and I didn't know why I was doing it. I had the nurse take some photographs of me and her just before the nurse left, a few hours before she died. And then I took photographs as my mom was dying. The last time she opened her eyes, I was taking a photograph of her. And then I took photographs and touched her body a lot after she died, just to become comfortable with what happens during death. Like, how warm is her body? Did she get rigor mortis? I wanted to know the answer to those questions, and I found out the answer to those questions, and they weren't scary. And I think that has been a gift to me. And I just hope that if you need that, like I did, that you can find a way to become less afraid also. My notes here, the last nurse that I met with as my mom was just about to die, she said her body's shutting down, and she described for me the way that my mom's body was behaving. She said the organs are really struggling, and everything inside, she's like going inward, and everything inside is just figuring out that it's not going to work anymore. And there's a big battle and struggle going on inside of her. And that was hard for me to hear. But also, in hindsight afterwards, seeing how quickly it happened, it just seemed like it was so right. that my mom didn't have to suffer, that she was in a good space really up until the end. She had her moments of panic where I had to sit her up, and that's really the main times that she was really in a bad space. But that didn't last very long because I was always really close by and could meet her needs pretty well. So it's a pretty good story in spite of how unprepared I was for the quickness of it all. But I can say that I am not going to be flippant about cancer anymore. I started out my journey a few years ago, my first videos, if you find them, I look pretty flippant. I knew intuitively that it wasn't an emergency for me. And I guess that's the other really big lesson, is follow your intuition, because it is so powerful. My mom's intuition was so right on, and mine has been too. But I am never going to be flippant about the power of cancer to take a life. I mean, it was so powerful in my mom's life. And like I said, my mom kind of wanted that at that point. She wanted an easy out and a quick ending. But I don't want that anytime in the next 40 or 50 years. So I'm not going to be light or flippant about cancer in the future. I've learned just how powerful it is. And I still do not see myself as a powerful warrior against it. I think the medical system has the tools and the weapons, and I, can use those tools and weapons, but I am probably not as powerful myself as cancer is in my body if it should resume its power there. So I'm very humbled by this experience, and hopefully will be taking the C word a lot more seriously than I have in the past. I'm sure that there will be lessons and revelations as I go forward. I've only been a week and a half away from this experience, but I just wanted to share some of the fresh lessons and things that I've come away with this experience carrying. A lot of gratitude, a little grief, a lot of grief actually, but not too much grief with regard to the medical system for once. So that's really nice to have a positive story to tell about something that's been pretty grueling, and the medical system really came through well. I think because hospice has been built on a tradition of really, really quality care, it's a little bit different than our experience dealing with your typical hospital type system. It's just very different. And I just hope that if anything, I could encourage you to go away from my story here with less dread or fear towards hospice. Anyway, my future videos will be much lighter than this one if you're gonna tune in and subscribe. I'll be talking about scar healing in my next couple of videos. I've had a lot of really good experiences with my red light therapy device that I purchased a couple of months ago, and I'm about to have a mastectomy tattoo, so I'll be recording some of that experience if my tattoo artist is open to it next week. And so we'll be talking about tattoos and scars in the next couple of videos, and I hope to see you then. Take care.